I first heard about the surgery, believe it or not, in 2015, but it was very experimental there. And we started offering the open surgery here in 2021, and around the same time began working on how we could increase our capabilities to allow us to do the fetoscopic approach here. Now, we went to other institutions and saw it. We had actually a surgeon who had performed many of them come out and be here for our first several. We're now to the point where we can do it very, very comfortably with the outcomes that we desire. A landmark trial that came out in 2011 called the MOMS trial, or the Management of Myelomeningocele Study, found that if these kids who qualify undergo fetal surgery, first, it decreases the chance of them needing a shunt, which would drain fluid from the brain. Secondly, these kids oftentimes can have an improvement in their motor function, meaning a child that might not have walked could walk with assistance, and those that maybe would have walked with assistance can now walk on their own. And then it has some implications for bowel and bladder function. I personally think that we'll get to the point where we don't have to make a bigger incision on mom as technology gets better, as our instruments and tools get better. I also think that there's most likely going to be a role for additional medications or stem cells to somehow help amplify or improve the outcomes. As we've seen progress over the last 50 to 100 years in medicine, you can imagine what we'll see within the next 10 to 20 here.